We've been covering in our news recent weeks the outbreak of measles and other infectious diseases, a growing concern right across this country, to the point that some doctors are warning now it's not just children who need to be protected. Adults as well, born between the 1970s and the mid-1990s. Turns out if that's you, you could be more at risk than you think. Cass Rusi explains.
Today, most physicians vaccinate.
When vaccines for measles were first introduced in the 1970s, a single dose in childhood was considered protection for life. At least that was the thinking back then.
As it turned out, that was good enough for about 85% of people, but about 15% of people would have a wearing off of the vaccine, and then they would become susceptible to getting the measles.
Meaning some people born between 1970 and the mid-90s could be unknowingly under-vaccinated today.
Those people may be walking around out there and they may be susceptible to measles and not realize it.
Some of them, she realized, were her own patients.
It looks like about a quarter of our practices may be made up of that cohort of people. It's a large group of people.
It could also be the case for other childhood infections like whooping cough or chicken pox. That's why a second shot, a booster for measles, became standard practice in the 90s. A surprise to many today.
I mean, my kids are vaccinated. That's definitely on my radar, but for myself, I just sort of assumed that I was protected. So now I'm going to go check.
Anthony Acab, born in 1975, didn't even know he needed a booster shot.
I'm assuming that it would be too late for the vaccination, or it's still possible.
A simple blood test can check your measles immunity.
The easiest and the safest and effective thing to do is just to be vaccinated. That's a very practical way of managing the uncertainty about immunization records.
Especially if you're traveling to places where measles might be circulating. Cass Rusi, CBC News, Toronto.
As we listened to Cass's report, it made us think we need to find out more about this and look at this advice in a little bit more detail. So with me in studio, you've met him many times before in this very place, Dr. Isaac Bogosh, an infectious disease specialist at Toronto General Hospital. Thank you for coming in today.
Good morning.
And you were listening to Cass as you're reporting it. The surprising thing that there are many adults under-vaccinated, not knowing about that. Are you seeing that at all in your practice or surroundings?
Yeah, I mean, there's a lot of people out there who were born between 1970 and 1995, 96 who have done everything right. They went to their physician as a child, they got their routine immunizations, and it turns out the policy changed in around 1995, 1996 in Canada, where we realized that one vaccine for measles, which was given between that time frame, was pretty good. It's just not good enough. And after that time frame in 1995, 1996, two vaccinations were given. And we know that long term, the two vaccines are extremely effective, about 97 to 99% effective, whereas the one vaccine dose, the immunity might wane over time, and maybe 15-ish% of people might lose their immunity.
Yeah, that was an interesting fact, that it wears off in that group of about 15%. Why in some people, but not in the vast majority of others?
It's interesting. It actually has nothing to do with people being ill or having problems with their immune system. It's really an individual's immune system and their direct response to that vaccine. There's really no wider implications of that. So if some people lose their immunity after one vaccine, but other people do not, it really doesn't have any impact on anything else in their lives.
But the part of the story is that they may not even know it. So 70 up until 95, 96-ish, this is the key time frame that we're looking at because it may wear off. What about before 19? You said you're fine after 95, 96, 97, but what about before 1970?
Yeah, before 1970, we presume that most people were exposed to the virus and had the infection. And we know once you've had this infection, you're immune for life. I mean, it's a nasty infection, but people will be immune to this virus for usually, hopefully, the rest of their lives. If you are unsure, if someone was born before 1970, if someone was born between 1970 and 1996, if there's any uncertainty at all,
don't have your immunization card at home, don't have a clue.
These are easy answers. Go talk with your family physician about this. Family physicians and primary health care providers are well equipped to have these conversations, to discuss the nuances about this. And as that clip pointed out, Dr. Sarah Wilson, a public health specialist here in Toronto, pointed out, an extra dose of the vaccine, a booster of the vaccine, when there is this uncertainty, is completely safe. We know this vaccine is safe, it's effective, it's widely available, it's free. I mean, there's really no reason in 2019 in Canada to have the measles.
So the also point was you could have a blood test to see your level of, immunity if you want. But you're suggesting if you have any questions, just go right to the booster, get another vaccine?
Yeah, it's a good point. And the blood test can be helpful in some situations, but not all situations. And it's just a good idea to chat with your family physician or primary health care provider to put it all into the proper context.
Come back to the point you were starting to make. Here we are in 2019. We're talking about measles in adults. Measles, a disease that one would have thought was long behind it. How do you feel about that as a medical practitioner?
Yeah, I mean, like, this is, in all fairness, this is crazy. I mean, we really shouldn't be having these outbreaks that we're seeing. We've had measles cases all across Canada. Big outbreak in New York. There's a big outbreak there was an outbreak in Washington, D.C. Europe is having historic cases, tens and tens of thousands of cases of measles. This shouldn't be happening. This is, it's obviously very frustrating. There's no cookie cutter, one size fits all answer to this. This is obviously going to take a multi-pronged approach with medical community, scientific community, the general public, engagement, I mean, government, media, exactly. There's just a lot of misinformation that's being amplified on social media that's really causing a lot of harm, and it's certainly a challenge.
Okay, with all those countries that you mentioned in this world of travel, this is why it's important, easy to bring back home.
Yeah.
We've seen that. So any questions, get that booster shot even as an adult. Thanks for coming in as always.
Thanks for having me.
Dr. Isaac Bogosh from TGH with me here in studio on CBC News Network.